any LGBTQ youth experience daily. Initially intended to focus on this problem within the school system, it has since expanded into workplaces, university campuses, and sporting events. Nearly millions participate by staying silent for the duration of their day, representing the silencing of LGBTQ students. At the end of the day, the silence is typically broken with a rally or speaking event, allowing all participants to end their vow together. Today, there are over 10,000 institutions registered as participants in the Day of Silence. All 50 states are represented in this number, as well as a number of other countries, including Singapore and New Zealand. Day of Silence continues to grow as more and more people become aware of the issues facing LGBTQ youth. For this year's speaking event for Day of Silence, I felt that MSPA would be remiss not to mention the blatant discrimination towards LGBTQ youth in Texas and Florida. I'm now going to invite up a few friends with me to read off some poignant stories and statistics regarding the legislative challenges that the LGBTQ community is facing in those states.
In 2022 alone, state lawmakers have proposed a record 238 bills that would limit the rights of LGBTQ Americans this year, with about half of them targeting transgender people specifically. Anti-trans bills include measures that would restrict LGBTQ issues in school curriculums, exclude transgender youth from athletics, not allow them to use bathrooms that correspond with their gender identity, and receive gender-affirming health care. In response, the American Medical Association sent a letter to governors in April urging them to oppose the state laws that would ban gender transition-related care.
A medical student in Texas writes...
You could pull it up.
Yeah, you're right.
You twist it, you twist it.
A medical student in Texas writes, the directive in Texas that calls gender-affirming healthcare child abuse makes me afraid to practice and outraged that any state can insert themselves into the clinical decision-making that we spend thousands of hours honing over several years. There are so few doctors who treat people who are transgender, let alone specialize in medicine specific to their needs. These laws could dissuade clinicians from entering this line of work. Instead of enacting laws that deny the basic healthcare rights of the trans community and signal to trans individuals that they are not safe or accepted or supported, clinicians and advocates that use us and everyone in this crowd, that's us and everyone in this crowd, need to work together to create laws that counteract and prevent the healthcare disparities that are exacerbated by the enduring discrimination of this community.
The Trevor Project is an organization dedicated to suicide prevention for the LGBTQ youth, and it has received more than 10,800 total crisis calls, texts, and chats from LGBTQ youth in Texas looking for support between January 1st and August 30th, 2021. More than a third of those crisis contacts came from transgender or non-binary youth. Studies have shown that LGBTQ youth face higher health and suicide risks than their transgender or straight peers. They have also found that when LGBTQ youth learned about LGBTQ issues or people at school, they had 23% lower odds of reporting a suicide attempt. This is one of the many reasons why education and representation matter. Okay, now we're going to transition to a big issue in Florida. On March 28, 2022, Republican Governor Ron DeSantis signed Florida's controversial House Bill 1577 into law, colloquially dubbed the Don't Say Gay Bill. This bill forbids public school teachers in Florida from holding classroom instruction about sexual orientation and gender identity in kindergarten through 3rd grade. Here are key passages in the bill. Instruction on gender and sexuality would be constrained in all grades. Schools would be required to notify parents when children receive mental, emotional, or physical health services, unless educators believe there is a risk of abuse, abandonment, or neglect. Parents would have the right to opt their children out of counseling and health services. Florida would rewrite school counseling standards. This is not only an affront on the LGBTQ community, but to mental health progress for a very vulnerable population. For instance, the student could also be seeking health services for depression, substance use, or parental divorce. Therapist confidentiality is often a key part in encouraging young people to reach out for help, especially when their own family is unaccepting or judgmental towards receiving help.
For Delaney Ocock, a senior at Olympia High School in Orlando, the bill is an unnecessary barrier to LGBTQ students such as herself from having an essential support system at school. The bill is sending a message to LGBTQ youth that they have something to be ashamed about, that their identities are so taboo that they shouldn't even be talked about in classrooms. In a world that already shames LGBTQ people enough, children are learning and developing who they are, don't need any more of that stigma. She said the bill also incorrectly assumes that kids are able to openly have LGBTQ-centered discussions at home. This bill is taking away a safe space from children and requiring teachers to out students to their parents, which could be very dangerous for these children, both mentally and physically.
In response, students all over the country, including many in Georgia, have been protesting in solidarity with the students in Florida who have been impacted by the Don't Say Gay bill. One student in Georgia, 14-year-old T, a junior and president of their school's Gay Straight Alliance, stated, "I didn't even know so many people were going to come out. I was so scared and there was only going to be 3 of us, but I turned around and all those other people came. It was so amazing, I almost cried." At the same school, teacher Sarah Galatino-Ruff stated, "I am so proud of our kids for organizing an event and making it clear that even though this bill doesn't seem to be threatening Georgia, that they are standing in solidarity with kids that this does affect, and making sure that everyone knows that we support and love them. I'm just so proud of them."
It was also very powerful to have President Joe Biden speak out about this bill, saying, "I want every member of the LGBTQI+ community, especially the kids who will be impacted by this hateful bill, to know that you are loved and accepted just as you are. I have your back, and my administration will continue to fight for your protections and safety you deserve." We'd also like to commend Albany Med's very own advocacy committee, which was recently founded, for another amazing lobby day, a day of advocacy where AMC students meet with New York State legislators and speak about issues we care about as future healthcare professionals. This year we spoke with senators to push for an updated sex ed curriculum in middle schools and high schools, which would require comprehensive education on HIV/AIDS, discussions on consent, and medically accurate and queer-inclusive education on human anatomy and reproduction. I'm really grateful to be living in a state where I can be politically active about LGBTQ rights and voice my true opinions with minimal backlash. But this is also all the more reason why we need to stand in solidarity with students in oppressive states, as you are all doing today by attending Day of Silence. Lastly, consider the compounding effects of being a member of multiple marginalized communities, also known as intersectionality. Consider how racism, sexism, ableism, and socioeconomic status can intersect with homophobia, and how this can really take a toll on our community if we don't do something today to actively confront it. Here are examples of things that MSPA are currently doing to promote LGBTQ equality and projects that you can support. So far what we've accomplished, we formerly used to just be a pride group at MSPA, and we've since joined the national chapter of MSPA, or Medical Students Pride Alliance, and this was founded by Joe Araj, a third-year medical student. He's also started the tradition, which has been followed up by Travis this year, of Health Week, which is a week of LGBTQ health-related events. And thank you for anyone who came out to that. Travis also started the Pronoun Badge Project, and most of you have that right now. I think it's wonderful because it starts the discussion on pronouns without making it seem strange or like you have to intrude on the conversation for it. And finally, I'd like to thank our advisor, Dr. Margolis. He got trans care into the OB-GYN curriculum, and this is his first year here, as well as into the medical school clinical bridge curriculum.
We would also like to highlight some projects that MSPA is currently in the process of working on, which include updating the Albany Med website so that it displays the pronouns of Albany Med staff, ensuring that the correct names of trans and non-binary staff and patients are present in institution-wide electronic systems and on patient charts. We're also advocating for gender-neutral bathrooms throughout the institution, and we're working on creating a service learning program with the Capital Region Pride Center, which would provide medical students with the opportunity to serve LGBTQ+ populations here in Albany, as there are currently no service learning programs that serve the LGBTQ+ population. We're also working to have Albany Med assessed under the Health Equity Index, which is a national LGBTQ plus benchmarking tool that evaluates healthcare facilities' policies and practices related to equity and inclusion of their LGBTQ plus patients, visitors, and employees. We're also working to establish an outlist here at Albany Med, which is essentially an online directory and database that several other healthcare organizations throughout the country have established of current and past LGBTQ plus students, staff, and faculty. Creation of an outlist would allow for LGBTQ plus visibility and connection, and would also make it easier for patients to connect with LGBTQ plus providers. We're also working to have Albany Med march and be represented in this year's Capitol Pride Parade on June 12th. And finally, we're petitioning for LGBTQ plus and Muslim psychiatrists to be hired by the Albany Med Student Psychiatry Office in partnership with the Muslim Student Association.
Okay, here are some more resources and things you can do to help the community or further your education. We mentioned the Trevor Project before, but they are an organization that provides 24/7 crisis counseling for LGBTQ youth, and it advocates for mental health care for these youth with the goal of suicide prevention. Ishmael has introduced to me something called Project Open Books. It's an organization committed to improving and promoting access to age-appropriate LGBTQ books and stories. Their goal is to provide books in order to create a more inclusive space, whether that be at home, the classroom, or office, or in a place of gathering. In Our Own Voices is also an incredible local organization here in Albany that works to ensure the physical, mental, spiritual, political, cultural, and economic survival and growth of LGBTQ, BIPOC, which is Black and Indigenous people of color. They engage in advocacy work, counseling, emotional support, emergency assistance, support groups, HIV and Hep C testing, and community events. Watch out for their Black and Latinx Pride in June. The Albany also has a Damien Center, which is a local resource center designed to improve health, reduce stress, and increase the quality of life for individuals and families living with and affected by HIV/AIDS. They provide services mainly specifically for LGBTQ people, including health navigation, employment navigation, assistance with insurance, hormone replacement therapy, and other gender-affirming services, as well as HIV testing and counseling. Finally, the Pride Center of the Capital Region is another local organization here in Albany that works to provide various resources to the local LGBTQ community, including training, education, and various support groups. They also host the Capital Pride Parade and Festival each year that we're trying to get AMC into.
Finally, we'd like for everyone to hold a minute of silence as we reflect on the stories we've heard today and think about how we can improve on a personal level, professional level, and community level. We would like everyone to have the opportunity to come up and sign our banner as a way to show your commitment to working towards providing a safe and inclusive environment here at Albany Med, and to stand against the harassment, discrimination that the LGBTQ plus community faces. Our banners. Thank you all for coming out today.